has a rising maternal mortality rate, doubling in the last 2 decades. And Iowa is no exception, as those in rural settings struggle to receive proper care. KCAU-9's Marina Bach tells us how moms are planning ahead and what local hospitals are doing to combat the issue.
Expecting mothers in rural areas face the unique hardships of traveling long distances to find accredited doctors to deliver their babies, which is why more rural hospitals such as Floyd Valley Healthcare in Lamars are trying to work to provide the care these women need at a location that is convenient.
We are really excited, and it's hard to believe that November 22nd is almost here.
Kristen Fober and her husband Luke Fober are eagerly expecting their first child.
This is just such an exciting time, and we're looking forward to having a little person in our family.
But that excitement can be clouded for many families who live long distances from hospitals. Nationally, rural maternity units are closing, with 8 shutting down in Iowa just last year, causing women who live outside of city limits to be at a higher risk for infant death and childbirth-related complications. Hoping to combat that problem, Floyd Valley Hospital in Lamars is looking to add on to their family medicine doctor team.
For some OB patients who still travel to the big cities to deliver their babies, we are capable of delivering your babies and take care of you here in our own hospital. You don't need to go travel far away.
It's an ease to only have a 5-minute drive and not have to worry about a half hour somewhere else, or 40 minutes, or even an hour.
In Iowa, 1/3 of births are in rural areas. That's creating travel barriers for many expecting mothers in need of emergency assistance. In many cases, those small hospitals are not able to take on those high-risk pregnancies.
A patient wants a vaginal birth after previous C-section. So those patients from the get-go we cannot deliver here. But we can provide the prenatal care and then refer them when it's time to have the baby.
But even though they don't always have the resources to take on every case, the hospital is working hard to add quality care to rural areas, especially for those who are wanting to add to their families.
Know that we're in good hands here, and that they will do the best that they can, and that's all we can ask for.
Along with expecting families, the family medical team at Floyd Valley is growing. They're adding on a new OB doctor by next year, helping deliver the 120 births the hospital takes on each year. Marina Bach, KCAU 9 News.